concerning case numbers and are working with the community and other partners to address the situation. The community will remain at critical red on the provincial pandemic response system, and we've increased the restrictions for that community in partnership with the Chief and Council. Chief and Council have directed that public gatherings are not permitted and community residents are required to stay home. People should not leave their seek testing, should only leave their residence to seek testing or medical care, or could send one person from each household for essential supplies. People who work in essential services are able to leave their residence for work. Non-medical masks must be worn outside of the home. So it remains critical that we continue to follow the orders currently in place and those fundamentals as well to continue to decrease the transmission of this virus. When we announced the modest loosening of restrictions 2 weeks ago, we did not remove the essential items list from the Northern Health region. In the last 2 weeks, we have seen a significant amount of travel from the Northern Health region to obtain non-essential goods. So a lot of travel from northern communities into Winnipeg especially. So we definitely do not want to see that interprovincial travel, again, certainly not for non-essential items. And so in an attempt to reduce that, we are going to eliminate the essential items list as well in the Northern Health region. So in that capacity, all retail stores can remain open. They will not have to follow just a non-essentials list. We'll be able to sell, won't be limited by that non-essentials list. The 25% capacity with a maximum of 250 will remain. The other services, the other loosening that we've done in the South will still remain in place. So we have no personal services that will be opening, including the hair salons. We're still not allowing any social gatherings within households. This will go into effect at 11:59 tonight and will be in effect until February 12 at the same time as how our other orders are. We're going to continue to follow the fundamentals. Really important to stay home sick. We mentioned here many times people with mild illness still going to work or to childcare with mild symptoms, thinking that it couldn't be COVID, and it certainly can be. We certainly see a proportion of individuals with very mild symptoms. So if you have any symptoms at all, please stay home. Please get tested as soon as possible. It's the best way that we can limit the transmission of this virus. That should still be in place, that if somebody is symptomatic in a household and waiting test results, everyone should be self-isolating pending those results. We have to continue to focus on these fundamentals to protect ourselves, our loved ones, our community, as well as if we're really planning on moving forward with our continued cautious reopening plans. Reminder that text messages are being used to support case and contact monitoring on a daily basis, in addition to phone calls from contact tracers and automated phone messages. Text messaging is for monitoring is being used in combination with support from members of the Manitoba government's contact tracing team throughout the isolation period. Responding to these text messages is needed. If you receive a text message but prefer a phone call instead, you must first respond to the text message and then can request further follow-up. Text messages are being provided as an additional service to augment the contact tracing team's overall capacity and provides other options for case and contacts to interact with public health officials. Starting today, individuals working in licensed child care centers, nursery schools, and family or group care child care homes within the city of Winnipeg, Hanover, and the Seine River school division boundaries are now able to access an appointment for COVID-19 testing at the FastPass site 1066 Nairn in Winnipeg. FastPass clients are able to access positive test results on the same day of receiving a test to enable faster contact tracing and earlier notifications. Eligible individuals can be tested if they are symptomatic or if they've been identified as a close contact or as a result of an exposure at a school childcare setting, or who have a symptomatic household member. Appointments for the pilot site are now open to eligible childcare providers and can be made online. Finally, we're always looking at ways to improve our reporting and accuracy in the data that we provide to you on that daily basis. To ensure accurate data when reporting deaths, a reset is taking place later today. This will put into place further checks and balances to increase consistency. It will also improve the regional data that we provide by allowing for additional review and confirmation. This means that there will be no death data reported tomorrow, Tuesday, February 2nd. We'll update and recap this information on Wednesday, February 3rd. So thanks, and I'm going to pass it over to Lanette.
Thank you. Good afternoon, everyone. So we are continuing to see our COVID-19 related hospitalization numbers improve and stabilize. Today, there are 255 COVID patients in the hospital as of this morning, and this is the lowest number that we have seen in hospital since November 18th. There are 102 patients who are in the intensive care units throughout the province, 38 who have COVID-related illnesses, as well as 25 of our 58 patients who are on ventilators have or had COVID. These numbers represent considerable progress from nearly 2 months ago when we peaked at 388 hospitalizations and 129 patients in the ICU. The number of COVID outbreaks throughout the province also continues to improve. Within the hospital facilities, there are currently 5 outbreaks over 4 facilities, and that's across the province, totaling 13 active cases. Meanwhile, in the personal care homes, there are 26 outbreaks occurring throughout the province. 22 of these outbreaks have 1 or less active case counts, and 14 of these outbreaks actually have 0 active cases, but they're working through the incubation period. So in total, amongst the personal care homes, including residents and staff, there are 50 active cases throughout Manitoba. The sick time for staff also continues to improve as we look at case counts and test positivity rates throughout Winnipeg. We can see that being approximately 94,600 hours were lost to sick time in this most recent 2-week period in the Winnipeg Regional Health Authority. And this is still a lot, but it's actually comparable to the averages that we've seen over the past 5 years. And actually in the same time period, it's a little bit lower compared to 2018. So we're happy to see that improvement. There were also in this last week 16 positive cases diagnosed for COVID involving healthcare workers, and this was ending January 28th. There were 10 cases in Winnipeg, 4 cases in Prairie Mountain Health Region, 2 in Southern Health Santee-Sud, and 0 in Interlake Eastern and Northern Regional Health Authorities. Again, just for a comparison, in early to mid-December, we had 83 healthcare workers who tested positive for COVID in a 1-week time span. With regards to surgery, we continue to slowly and steadily increase the surgical capacity throughout the province. Here in Winnipeg, an additional surgical slate has been added today at the Misericordia Health Centre, where they will be doing more eye surgeries as well as pediatric dental procedures. And an additional slate is tentatively being planned for Concordia Hospital, where they will be able to do more orthopedics, spine surgeries, and plastic surgery cases. Electromyography is a test which explores the brain activity, and it's for patients who have neuromuscular or neurological disorders. So those will be restarting shortly at Riverview Health Centre. In Southern Health Santee-Sud, Carmen Hospital will be resuming their endoscopy procedures today, and additional surgical procedures have already previously been resumed at the other sites throughout this region. And finally, surgical capacity has also been added over the past 3 weeks in Northern Regional Health Authority at Thompson General Hospital, as well as various locations throughout Prairie Mountain Health, including Brandon Regional Health Center. So as we start to shift the work back to our normal activities, our normal service deliveries, including surgery, staff are beginning to now be redeployed out of those high priority COVID areas, including personal care homes, critical care, and medicine, and gradually coming back to their home units. This is intended to be a slow and cautious shift because we do have to still continue to care for COVID within our facilities. So just want to ask for people's patience. I understand they want to get back to where they came from, and we totally understand that. But we're just trying to really balance the needs within the system, and as soon as possible, we will be communicating more information as it comes. So these numbers, these improved numbers across the board, really is the efforts of all Manitobans making so many sacrifices for so many weeks and months. So I just want to acknowledge all those efforts, all those sacrifices, and we're definitely going in the right direction. Dr. Roussin knows I love double-digit days like today. I would also, though, encourage everyone, we want to keep going in this direction, so please stay safe, continue following the restrictions, and as we wait for this vaccine to continue to be distributed. But it's great momentum, and we're really excited and hope to get back to normal soon. And with that, we can open the line to questions.
Thank you. A reminder to our reporters on the line, you will have 1 preliminary and 2 follow-up questions. Up first this afternoon from CityNews, Jonas.
Good afternoon, folks. Ms. Siragusa, just want to touch base with you today. These are some of the most positive numbers I think we've heard in quite a while on the healthcare front. Just maybe a sense of the mood within the system amongst healthcare workers that have been in this marathon for so long that are maybe now seeing some relief.
Yeah, I think knowing that there's light at the end of the tunnel is reassuring and definitely gives some hope. But I would say we still feel a little bit in a precarious situation. Not everyone has gone back to their home sites. There's still nurses who are working in the personal care homes. There's still staff who have been redeployed to critical care. So they're anxious to get back. They understand the demands. So it's really a mixture of emotions, I would say, and I would say anyone who's actually struggling at the pace at which this is going, that they should be reaching out, talking to their managers, getting, as soon as we can share information, we will. We know everybody wants to go back to normal as soon as possible, but it is going to be a slow, steady, cautious change. But overall, you're right, it is very positive and we're going in the right direction, and we're very grateful for that.
As a follow-up, Ms. Siragusa, just on the active hospitalization number, is this one of the key metrics you guys are going to be looking at as we move forward? I assume this is probably one of the better ways you can judge caseload and the impacts right now.
Yeah, we've always looked at a variety of different metrics in order to determine what our next steps are. So part of it is for sure the hospitalization and the critical care, but also looking a little bit looking at the testing volumes, the numbers, the positivity rates, and the number of people who are isolated, because those potentially will be coming our way. So we're seeing those numbers are looking better. People are following the public health recommendations. So yes, it's definitely looking better. The critical care numbers are not going down as quickly as we thought they would, and that's likely the nature of COVID when you have to be intubated and your lungs are affected, it takes some time to recover from that. So we're hoping it's just a delayed response, and we'll be seeing those critical care numbers improve soon as well.
Thank you for that. And as we progress here over the last couple of weeks, the North has been really exploding. Just maybe outline maybe some of the plans that are in place for enhanced care, and what is going to happen as folks from the North maybe need more hospitalization or ICU admissions as things go on.
Well, I'll start, and then Dr. Roussin maybe can jump in as well from a public health perspective. There has been really great collaboration with our First Nations partners. They're proactive, doing everything that they can to minimize the spread in their communities. So we will continue to work with them, and I know that they have, when they need support, they reach out for support. Sometimes that support goes into the community, so we've had public health nurses from different regions go in and support. We have a rapid response team from Ongamazin, from the university, and there's lots of partners, a coalition that goes to support. So that happens in the community. But also we may be transporting people out for the isolation, especially those vulnerable chronic disease people, so that they're closer to acute care. So we will continue to meet the demand as it presents, and make sure that we provide a good service and keep the spread of COVID to a minimum. Is there anything else from a public health perspective?
No, I think that's good. You know, public health certainly is on the ground with epidemiology support, as well as public health nurses helping with contact tracing. But you know, a lot of work being done at the community level to try to address the transmission.
It's really been the work of many partners to get that done too. So I just want to commend everybody for that work.
From CHVN, Taylor.
Hi, good afternoon. In your opinion, how has the loosening of restrictions gone so far?
You know, I think it's early as far as public health, numbers go. We're going to be watching that very closely this week and into next week for sure. We mentioned one of the unintended consequences of the loosening was keeping the non-essential list in the Northern Health region, where we're seeing all these numbers. We saw that likely led to a lot of travel, which we certainly wanted to avoid. So we're making some changes of that coming into effect later. But overall, I think that the reports are that people are still sticking to the fundamentals. They're following the restrictions. I think it's been some challenging times, and you know, if we can continue the progress that we're seeing, then we're hoping to again further the loosening as we go forward.
Yeah, along those lines, we are going to be now having our third weekend with the loosened restrictions. When in Manitoba will we hear about these restrictions being changed, or what could we even potentially expect?
So again, it's a little early to talk about what these next orders are going to look like. As far as the timing, I think we're still going to look for that, nearing that week ahead of the orders, that when they set to expire, to start again giving Manitobans notice of the types of things that we're looking at. And so, right now I can't speculate on what those orders are going to look like.
And today you announced about northern Manitoba, how there's going to be a little bit of changes when it comes to their restrictions. Right now, is the province looking at changing any other restrictions based on other health regions or districts?
Not right now at this point. We have these orders now. They're a bit more aligned throughout the province, and the next set that we're looking at is likely to be February 12th.
From the Winnipeg Free Press, Danielle.
Hi, good afternoon. Dr. Roussin, in the past 9 days or so, we've seen crowds and long lineups at retailers as well as at outdoor public places. Are you bracing for a spike in cases based on what you've seen since the restrictions were eased?
Well, we've always been prepared, so we'll loosen these things. Well, we thought very cautiously. There have been these lines, they're outdoors. I think a lot of the reports are that there's distancing occurring. So we're watching this very closely, but anytime we loosen the restrictions, we prepare to see increasing cases. And so if that occurs, we'll certainly be ready to respond.
Thanks. And what enforcement of public health orders has happened at Winnipeg malls to ensure capacity limits are being followed? And if you wouldn't mind, can you please explain the rules for wearing masks while waiting in line both inside and outside?
Yeah, so the as far as enforcement goes, there'll be an enforcement report, so I'll let the enforcement folks discuss the type of enforcement that's occurred. We have quite limited capacity at retail. That limited capacity also extends to the malls. Indoor public places people must wear masks at all times. In-line outdoors, I also suggest that we have distancing and wear that mask. Remember that removing and putting on your mask is a potential time for that self-contamination. So if you're wearing a mask, we should just leave it on for whenever we can, and just remove it when we're not going to require it for quite some time. So both indoor and out, especially when you're around other people, I would highly recommend wearing your mask.
Thanks. And on the subject of preparedness, what has changed since the fall so that public health can keep up with case investigations as people now have more contacts and more possible exposures?
Yeah, so there's improvements in in every sort of aspect of the public health response, right? So first is case identification. So we have a lot of capacity for testing. We have some rapid testing available. As far as isolation goes, we have increased alternate isolation accommodations, and we've also increased our ability to contact trace. So we're able to would be able to keep up with cases. Certainly, the numbers that we were seeing in October and November and December, we would be able to contact trace those in a timely manner.
From the Brandon Sun, Michelle.
Good afternoon. For transparency, these are readers' questions as per usual. Is there an end game to all of this? What is our goal? How many COVID cases per day do we need to get down to? Do you think it would be helpful for people's mental health to get some sort of light at the end of the tunnel rather than daily reporting of COVID cases? This can be quite discouraging, especially for people who are lonely, at risk of bankruptcy, etc.
Yeah, I think there's a lot of things going on right now with the pandemic. There's people who are directly affected by the pandemic, people who have gotten sick or lost loved ones due to the pandemic. There's people who are affected because of being out of work or their business being affected. So there's a lot of things going on. I think we've always mentioned that just like any pandemic, there will be an end to this. There will be a time when we get back to normal. We have the vaccine into Manitobans' arms in less than a calendar year after the agent had been discovered, which is quite amazing. And so there is light at the end of the tunnel. We can't simply just say what a specific number is of cases each day, because there's a myriad of indicators that we have to look at, including healthcare capacity. But I think that our goal here is to keep these numbers down while we roll out this vaccine, get the most vulnerable Manitobans protected, and our goal is to gradually and cautiously reopen things here at the same time.
Thank you. Second question. The province appears to have stopped listing possible exposure points at Brandon area schools. None have been listed thus far in 2021, despite the fact that the Brandon School Division is sending out letters of notice for at least 4 cases in schools so far this year. What changed in the province's reporting, and is the province attempting to downplay the risk of transmission in schools?
Yeah, we're certainly not downplaying transmission anywhere. We report on cases and on contacts. So As far as the reporting online goes, I think that's being reviewed and being worked on. The real issue, and just like how our reporting goes with, public places, is we're going to inform contacts. So the most important thing is we inform contacts. So if there's a case in the school, we'll inform anyone that we feel is a contact or part of a cohort that's a contact, and do the appropriate investigations that way. And so similar to any other investigations, if there was no risk of exposure to the public and we are able to contact all the people affected, then that's the approach we take.
Okay, thank you. My final question, I finally get to ask a hockey question. What is the plan for the Western Hockey League? So the Wheat Kings and Ice. Alberta has approved a return to play for the WHL. Will Manitoba do the same? If not, why not?
Yeah, we're actively reviewing that plan right now, but we haven't made a final decision on it.
You're working on that? Is
Yes.
that what you, sorry?
Yes.
Okay.
From CJOB, Will.
Hi, good afternoon, everybody. Dr. Roussin, daily case numbers still relatively high in the northern region, but also quite a bit lower than they were a few weeks ago. So I'm wondering, what's your take on the situation up north, and do these lower numbers mean the situation is becoming contained?
Yeah, so we're seeing different epidemiology in most of the province compared to the north. We're seeing some isolated outbreaks, in the north, as well as some transmission in Thompson as well. So we're a lot of work being done to try to get on top of that, and then we'll look in say Winnipeg, where we're seeing a significant decrease over time. And so we'll continue to watch that. We have, we've tried the targeted approach in the past. We tried it quite recently, and it's difficult to have a very targeted approach with the public health measures, because we see how it can get bypassed just with travel, with mobility. So we'll continue to watch that. A lot of work is being done in North with a lot of partners, a lot of collaboration, and so we'll get those numbers down as well. And and this is likely going to allow us to continue with our progress moving forward with the slow, cautious reopening.
Okay, thanks for that. Lately, we've been seeing daily COVID test numbers between roughly 1,500 to 2,000 sort of thing, but I recall seeing that number go much higher. So I'm wondering, why are we not maxing out our testing capacity, and are we anywhere close to some form of limited asymptomatic testing?
So as far as testing capacity goes and testing, numbers, it's all on demand. So when you see those numbers of 50, that's how many people attended for testing. So if more people attended for testing, we would be able to report more. So we've always mentioned that even mild symptoms, stay home, get tested, even if you're not sure. We have much more capacity, so if you're not sure, go get tested. We have some targeted asymptomatic testing. And that's now for travelers. So returning travelers, whether you're symptomatic or not, we want you to be tested. That includes people who leave the province regularly. We're encouraging them to get tested when they return on arrival, and again at 7 to 10 days. So that would include the truck drivers again. So that's when we had very high demands on our testing capacity, we wanted to save that for, the most risky scenarios, and that's the symptomatic people. Now we do have some capacity there, so we have expanded the asymptomatic testing a bit.
All right, thanks. Final question for Ms. Siragusa. Lanette, you mentioned the COVID hospitalizations improving, but over the last few weeks we've heard you say capacity still remains above pre-COVID levels. I'm curious to know the latest in terms of any hospital expansions currently underway, or are you doing anything else to ease the strain on the system?
Yeah, the medicine admissions, people admitted to medicine units, really started moving into surgery beds. So it hasn't been an increase in overall space. It was more a repurposing of our existing space. So as surgeries decreased, more beds were available and staff were available to move into that. So slowly, as these numbers start to come down, then that means we can increase the surgery and use the surgery beds for surgery patients as opposed to COVID patients. So that's happening now. Every day, every week, that's reevaluated, and we're shifting accordingly. With the critical care, as I think everyone knows, our baseline is 72, so we still are over 100. We're not looking to expand the space at this time unless we see the testing numbers dictate that's what we need to do. So right now we're just keeping level at where we're at and planning for when we can start decreasing when the demand for critical care starts to slow down.
From the Winnipeg Sun, Scott.
Hi, good morning, or good afternoon, sorry, to both of you. Scott Bill from the Sun here. Dr. Roussin, Dynacare is offering antibody tests now in the province. I think they're doing it in Ontario as well. It costs something around $80 and need a doctor referral for it. But, you know, it is an option for Manitobans, it appears. Is it something you recommend for people to do, and what benefit would it have, or I suppose any kind of disadvantage to it?
So that's just the thing. There isn't a lot of a clinical benefit for it. We don't know a lot about these antibodies. Just because you have a positive antibody test, we don't know that means you're immune. So there's limited benefit in that area. There's certain clinical scenarios where it might be a little bit beneficial, and in that aspect, clinicians can call the lab and ask for that testing. So it is offered here, but just on an individual clinical level, very little utility. Seroprevalence studies, they can be useful and are certainly being done, but just at the individual level, there's not a lot of utility to it at this point.
Thank you for that. Over the weekend, the Church of Restoration, I think that's what it's called, in Steinbeck, the one that's been in the news quite often, gathered, posted videos of that. You've talked about the ability to issue a shutdown order before. Is that something that you would be considering at this point?
So, there is an ability to have a health hazard order and close a premises that was posing a health to the public. I think there's a lot of enforcement options, and so we'll hear more about enforcement tomorrow on it. I think that it's, to pretty much everyone, this has been a real difficult time for various reasons. And but we can see that these restrictions have a beneficial effect. We can see our numbers coming down. We can see that our healthcare system is starting to get, back to care for all Manitobans. And things like this just put us all at risk. So it's not enough to just assess your individual risk and make a decision on whether the risk is outweighing the benefit for you. The issue is it puts us all at risk, and that's why we have these public health orders. So, we hope that we can get back to a lot of the things we love and miss soon, but these type of things compromise our ability as a province to do that.
And my final question, and I understand you're not the former education minister, but one of the province the province made prior to schools reopening during the summer there was one of transparency, including listing all the schools with exposures online. It was promised to Manitobans, especially the parents, obviously, that would happen during this school year. And so it seems then that these cases obviously haven't been posted. I guess I'm wondering, and you might not be the one that can answer this, but you're the one here today. Why was the decision made to break that promise?
I don't think that there is an issue with the transparency. So the most important thing with any case investigation is to get the case identified and isolated and in a contact investigation. So this is what's happening. Letters are going out to parents. Letters are going out to families affected at affected schools. So as far as transparency goes, I don't think that's an issue. As far as the way it's reported, I'm not sure about, how or what specific sort of decision was on just some of the reporting online. So maybe we can get some more information on the specifics, but I think there's still more working. But, to be clear, I don't think there is an issue with transparency. If your child is at a school or in a class that had a case, you're going to be notified.
From CBC Radio Canada, Gavin.
Hi, Dr. Roussin. Gavin from Radio Canada here. Was reopening non-essential stores in the north really the only solution you had in this case? I think to some people this might look more like a capitulation to those who don't respect sort of the spirit of healthcare orders.
So when we make these orders, we have to consider a number of things. We have to consider, the disease dynamics, the transmission dynamics of the virus, but we also have to consider human behavior and what's realistic as far as what we can enforce. And so we had these measures in place. You're right. The spirit of the order was that because there was a lot of transmission in the north, we wanted those orders to be followed as before, because we want to. We can see from the restrictions that they work. So I think that we always have to be able to reply on what we think is going to be the best for Manitobans. And so in this place, we did feel that the non-essential items list, lifting that was of lower risk, and that's why we allowed it in the south. Seeing the amount of travel that occurred, we think that lifting that list in the north is far less risky than the amount of travel we are seeing. And as far as what other sort of realistic approach other than messaging, I don't think we had a whole lot in our arsenal.
Thank you for that. Where are the cases coming from in the Interlake? The numbers, I asked the question last week, but the numbers do seem to be creeping up there.
Yes, so so we did see some cases in Pangasi where we are issuing this new order, and that's a significant number there. Further, we'd have asked you to have specifics regarding that community from the First Nations themselves.
Thank you. And finally, Ms. Siragusa, what's the backlog of surgeries and non-urgent procedures like in Manitoba? Are you anywhere close to taking a bite out of it with the resumption of these procedures?
Well, we're starting, last week we did in Winnipeg 219 additional surgical procedures, but our backlog is bigger than that. We don't have exact numbers, but what we are using is a comparison of the number of procedures we did last year compared to this year. So in the late fall, when we slowed down surgical procedures, it's about 5,000 cases, the difference between last year and this year. So we are working through that data, looking at where the priority cases are and developing a strategy so that we can make sure we address that to the best of our abilities.
From CBC Manitoba, Ian.
Good afternoon. Dr. Roussin, in a morning radio interview today, you said there are plans to ramp up testing of the COVID variant. What kind of options are we looking at, and is there a percentage target for how many samples will soon be tested?
Yeah, so we're really early on that. We do have some specific plans, but I don't want to comment on the specifics at this point while we're still working out the details. As far as the percentage, through the national program, it's about 5% is what overall, and that's what we've been doing. And of course, that's been a targeted testing. We're looking at significantly increasing that and the ability to really test samples from all returning travelers and test samples from anywhere we're seeing high rates of transmission. So we'll have more details on that shortly.
Thank you for that. Dr. Roussin, again, you've continually asked Manitobans to abide by the travel rules. The province says Manitobans who want to visit their cottages in northwestern Ontario do not have to self-isolate. but the Northwestern Health Unit has issued a notice asking people to self-isolate upon entry to Ontario for 2 weeks. These are conflicting messages. Are there discussions between the two governments? And should Manitobans not go to their cottages if Ontario doesn't want them to?
So there hasn't been discussion, at least at the public health level, between provinces. We each will make our public health orders that we feel is best for our situation. As far as travelers, going to Northwest Ontario, our orders are specific that they should have that leave no trace, that they shouldn't really use any of the local amenities, should go to their cabin and back. And it's also listed in orders that if you do not follow the public health orders of that region, then you're no longer exempt. So we didn't want to, because of the local epidemiology there, the lower risk, we didn't want to, severely disadvantage cottage owners, that they weren't able to go to these areas that we felt were low risk if you're going straight there and straight back.
Okay. And finally, what are we seeing in the personal care homes that have already had the vaccine? Are we no longer seeing new infections? And within personal care homes, is there a percentage for how many adults have gotten the vaccine willingly and those who maybe have said no?
So uptake I know has been reported as very good. I don't have a specific number, but I hear high 90s of residents. As far as outbreaks go, we can see the outbreaks diminishing over time, and that's likely a result of just diminishing community-based transmission. Remember, with that vaccine, the first dose, we're not going to see any limited benefit until 14 days after the first dose, and not the significant benefit until a week or so after the second dose. So we're still a ways away from having everyone fully protected. And remember that vaccine has limited effect if you were exposed before, just days before receiving the vaccine, if you were incubating it, or if you received it within days to a couple weeks after receiving it. So we may be a little ways away from seeing the significant benefit from that vaccine. Nonetheless, it was, I think a tremendous feat to get those personal care homes the first dose ahead of schedule, and I think it's really a win for Manitobans.
From the Canadian Press, Kelly.
Hello. So just going off Ian's question, I want to confirm that there have been no variants found in Manitoba, right?
We have not found any of the variants of concern here in Manitoba.
So you spoke about seeing different kinds of epidemiology around the province, but you also indicated that targeted restrictions didn't previously work. So going forward, we're not obviously out of the woods yet. Are you moving away from targeted approaches if we see spikes in numbers?
Well, I don't think it's off the table. We're going to review and see how best they can work. I think that we really did an incremental approach in the fall and saw that our numbers kept climbing. We're in a much better position here, and at least in this iteration, our targeted approach had some unintended consequences. So we'll continue to review things, review the epidemiology. We'll do what we feel is going to be best for the situation. But I think this has raised some caution towards the targeted approach.
And you've obviously spoken to this many times before, but can you explain again what some of the challenges in the Northern Health region are that makes it more difficult to respond to the pandemic and keep its numbers lower?
Well, so that's at a number of areas. One, we know this virus transmits through prolonged contact and crowded areas, and so we know that in many northern communities there's crowding within households. We know that it's much more difficult to isolate, especially in isolated communities. So the people need to be moved out of the community to properly isolate. And we know that there's less access to healthcare, the more remote and isolated you are. So there's a number of number of issues that go on, but I think the rapid response teams, the number of collaborators, the First Nations leadership, have all really stepped up and are doing tremendous work to bring down those numbers. And I think that we'll be able to see that progress pay off in the near future.
And our final reporter this afternoon from CTV Winnipeg, Michelle.
Hi, just for Dr. Roussin, why not also limit travel to the north as we did in the beginning as well if we're going to prevent people from the north coming to Winnipeg?
So we do have the northern travel restrictions. They're still in place, and they were focused more at the direction traveling to the north. Obviously, has some exemptions on it. There's we had the targeted approach with keeping those restrictions in place. We didn't end up having our northern restrictions apply to travel of northern residents back down south. Certainly, that's the intent of it. So I think there's a lot of challenge with these type of travel orders, a lot of challenge with enforcement, and so I think that right now this is probably the right balance with just lifting the non-essential items list.
Okay, I also wanted to ask you, what more can be done from a public health perspective if continued increasing fines aren't enough to deter certain people or organizations from having gatherings?
So public health, provides the recommendations on what sort of restrictions should be in place and for how long. Exactly how they're enforced is not necessarily public health's area. And so, there are some options there. There's fines. We've increased fines over time. For immediate threats to public health, we have things like health hazard orders, which would require things to be closed until that risk is gone. So there are options there, but, we also have a lot of enforcement people working on this as well.
Okay, I also wanted to ask, would you consider testing personal care home residents for variants? Just because where we have the variant in Canada, it seems to be taking a pretty large toll on personal care homes once it gets in there. Would that be a targeted population you would look at?
Certainly, if we saw a transmission right now, that would be tested. So all outbreaks and things are being tested. I think moving forward, we're looking at ways to expand the amount that we're sequencing, and so yes, that would be a good spot to include that.
And this concludes our media briefing. Thank you.